Hi, I'm Dr. Robert Fiella, and thanks for watching this video. I hope you get some interesting information out of this and something that's going to help you. I'm going to talk today about fibromyalgia. What is it? What do you do with it if you think you've got it? And what kind of things do you present? I've been treating fibromyalgia for several years now, and I've been in practice for a little over 20 years. I was seeing cases that today would have been diagnosed with fibro. It seems sometimes to be a catch-all diagnosis when a physician doesn't know what's going on with someone, that they have chronic pain and they don't have anything on blood work or another analysis to hang their hat on, like rheumatoid arthritis, anything like that. Now, if you've got fibromyalgia, you know all about it, I'm sure. People who come in with fibromyalgia are some of the more educated people that I get to see in practice. They know all about their condition, they know what's going on with it, they know they've got it, and that's fine. I've been seeing cases that would have been diagnosed with fibromyalgia for 20 years. I remember a case in the late 80s that I saw at the original office I was at, and I did very well with her. She was very much relieved of her pains, etc., and turned out her husband was actually the medical doctor in charge of a very large pain management clinic. So, location unknown, names will be withheld, but I seem to feel very confident in dealing with chronic pain and fibromyalgia type cases. So if you've got it, you know all about it. It's the varying aches and pains, the disturbed sleep cycles, fibro fog, the inability to function, and you see how it affects your life and what it does to you, your loved ones, spouses, children, etc., etc. And you know, maybe you're worried about what's going to go on and what's going to happen with me now. Maybe you're also on medications, you know, the Lyricas or an antidepressant or something like that. My approach to fibromyalgia is very, very different. I'm a chiropractor. I am a chiropractic neurologist. I also work a lot in clinical nutrition, and I haven't found a fibromyalgia case yet that wouldn't respond to the types of techniques that I do in my office. I do get some results. There are a few cases I get no result on, and we know pretty fast about that. But with fibromyalgia, as a neurologist and a guy who looks at the body's function, okay, you come in with a diagnosis, you have fibromyalgia. All right, fine, you've got that. My approach is I want to take a look at your body and how it actually functions. Your nervous system has to work, the brain, spinal cord, the peripheral nerves, it's all got to work as a unified segment. Brain has many significant areas of functioning, and they've all got to kind of work in harmony. So you've got areas such as the cortical area, the large mushroom cap type area. You've got a part called cerebellum in the back of the head. You've got what are called the deep nuclei inside, which control your movements, etc. And then you've got a very important area called the brain stem, which comes down out of the brain and forms the upper regions above the spinal cord, but not quite into the brain yet. And these control several key functions, and we find disturbances in these areas a lot with people with fibromyalgia. Parts of these areas of brain kind of get what we call wound up. They're too functioning. This also ties in with certain glandular and chemical findings that we'll find on blood tests that coordinate really well with inflammatory events, inflammatory markers. And for instance, if you've been under stress or you're feeling stressed out or whatever, your two glands over your kidneys, the adrenal glands, release chemicals, and these circulating chemicals will actually increase pain responses. They are also toxic to parts of the brain and sort of lead into a vicious cycle where the more toxicity of the brain, the greater the pain effects that you feel, therefore the greater stress, therefore more chemicals get released, therefore more damage, etc., etc., etc. And this progression goes on until the person is very much debilitated and disabled. So what we want to do is break up those vicious cycles, get the person straightened out and back up, and I'll use whatever methods I need to get the person's functionality back on track. So we find I will use the more traditional chiropractic methods, but I also use methods involving the nervous system to bring that balance back and tone up, if you will, functioning areas of the nervous system that aren't really working the way they should be, and these help actually to tone down other areas that are overworking. So for instance, a person who has lack of sleep, typically with fibro, you're not sleeping at night, but you're really tired About 3 o'clock in the afternoon comes along, you're crashed. By 3 a.m., you're wired and you're awake. Okay, so something's wrong there and something's going on. Again, this is one of these vicious feedback cycles that you get into. So, to address that, we help to reset the body's clock, and I will do that with some nutritional methods and with some neurological methods to get you back on balance and back on track. You can go to, I don't want to take up too much time, you can go to my website to explore a little bit more about this. It's woodbridgepainrelief.com, and I have some sections, I have some more videos, and I have some sections there that explain the differences in what I do and what might make me different from other practitioners that you've seen. So, I like to see fibromyalgia cases. I like to see the ones who are committed to getting well specifically. If that's not you, well then we may not be a good match, because I work really well with motivated people who really want to get this thing done, okay, and get out of it. And when you've made up your mind to do that, that's the time to reach out and call me. But please, in the meantime, go to the website, take a look at the different things I do. And again, I hope you got something valuable out of this little video, and thank you very much.